Welcome to another episode of Hey Doctor. I'm your host Dee, and today we will dive into a health issue that's quietly becoming a global epidemic that's not only concerning the elderly, but also the youngsters. Nowadays, we often see diabetes making headlines due to the rising trend of sugary food and hyperpalatable food. This has transformed what was once considered a manageable condition into a full-blown global health crisis. The numbers are staggering. 1 in 10 people worldwide is now living with. But behind that overwhelming statistics are individual stories of shock and resistance. Today, we are joined by 2 people living with diabetes, each with different experience to share about their journey. Let's meet them. Hi.
Hi.
Welcome to Hey Doctor. Can you introduce yourself and tell us your journey?
Okay, my name is Sara and I'm a patient who's living with a rare form of genetic diabetes. It all started when I realized that I was starting losing weight rapidly and feeling thirsty all the time. And I was always tired. At first I didn't understand why, because I wasn't eating a lot of sugary food. After undergoing several tests, the doctor confirmed that it was diabetes caused by genetic mutation.
Can you tell us about your treatment?
My treatment depends on the type of genetic mutation I have. In my case, I need medication to help my pancreas release insulin. Some patients need insulin injection, but my doctor found a medicine that works better for my gene type.
How was your lifestyle before and after the treatment?
Before I was diagnosed, my lifestyle was very normal. I didn't follow any special diet and I ate just like everyone else. I was the type who ate a lot of sugary food, so I never expected anything to be wrong. Now my lifestyle has changed a little bit. I try to balance my meals, monitor my blood sugar, and get enough rest as suggested by my doctor. I'm not on a strict or extreme diet, but I follow a routine that keeps my sugar levels stable.
Thank you for giving us your diabetes journey. Now we will move to our second guest. Can you please tell us your journey?
Hi, my name is Rain. When I was diagnosed with diabetes at my age of 27, my body isn't like this. I was really chubby back then, and somewhat I didn't pay attention for my nutrition. Okay, and before I knew I had diabetes, I had this really small symptoms. For example, I constantly thirsty and craving for sweet drinks. And after that, I also noticed that I often use the bathroom, and also I feel like my body is sluggish and I didn't have any energy to do anything. And later I learned this is the common symptoms for diabetic patients. After my diagnosis, I decided to follow my doctor recommendation and eat healthily, and I began exercising regularly, monitoring my weight, and that's how I achieved my body and my healthy life.
Okay, we heard the stories from our 2 diabetic guests. Thank you both for sharing your stories. We will next move to the next segment after a short break. Welcome back to Hey Doctor. Now we will move to the next segment with our expert in endocrinology. Hello, Dr. Yaya Mazlan.
Hello, hi.
Thank you for coming to our show. Okay, now let's talk about diabetes. From what I understand, diabetes has a few categories. Can you explain to us what are the categories of diabetes and what are the factors and treatment for each categories?
Diabetes have 2 types and subtype, which is gestational diabetes. Today, we will focus on the 2 types of diabetes. Usually, people suffer from type 2. I will explain type 1 diabetes first. Type 1 is an autoimmune condition where the body's immune system mistakenly attack and destroy the insulin producing beta cell in the pancreas. This result is little or no insulin production, meaning the body cannot move glucose into its cell for energy. Factor in type 1 is usually diagnosed in children and young adults, but it can develop at any age. Genetics An environmental factor are believed to play a role and it cannot be prevented. People with type 1 diabetes must take insulin daily to survive. While type 2 is a type that occurs when the body cell don't respond normally to insulin. The pancreas eventually cannot produce enough insulin to overcome this resistance. This type is most common form accounting for 19 until 95% of cases. Risk factors include being overweight or obese, physical inactivity, family history, and the risk increase after the age of 45. Treatment often begins with lifestyle change like a healthy diet and exercise, by regular oral medication or insulin therapy over time. Type 2 diabetes can often be prevented or delayed with a healthy lifestyle.
Thank you, Dr. Yaya Mazlan, for sharing your medical advice with us. We hope that after this segment, people will be more aware of their diet and lifestyle. That's all for today's Hey Doctor segment. Let's meet again at the same time, at the same place next week.